Thank you so much. Pleasure to see you all here this afternoon. Thank you for coming here after lunch. Being called Rolly actually reminds me of school. That used to be my nickname, but that's seldom used these days. My name is Dr. Roland Dilling. I'm the Director and Chief Medical Officer for AWS Public Sector Health. I trained in medicine. I originally trained as a surgeon, in fact, and did research in Oxford University into image-guided cancer therapy. I then retrained in radiology and was the director of the Interventional Oncology Service, Image-Guided Surgery Unit in University College London. I then went on to be Chief Medical Officer of the biggest imaging and intervention group in Europe before joining AWS. And here I currently am responsible for healthcare outside the US. So, what I'd like to talk to you today is about our healthcare strategy. And I'd like to take you through some reasons why doing healthcare in the cloud is both beneficial and the way that we're approaching talking to our customers. I think it goes without saying that there is a massive amount of disruption taking place in healthcare in particular when it comes to digital transformation. The promise of digital transformation has been around for many years. I spent a long time in healthcare, always waiting for it to be transformed, always tomorrow, it'll always be there. But I think we've actually got to a point where we're seeing real change. And there are a number of factors behind that, and I'll explain why I think that is the case. Now, before we go into healthcare in particular, again, this is an AWS Public Sector Summit, so I don't need to tell you that you use the cloud every day in numerous settings. So all of these brands that you use every day and you see around are all powered by the cloud, especially Mandalorian I like. So I don't know if any of you watch Disney Plus, but I'm a great fan. AWS already powers an enormous number of public sector organizations outside healthcare industry. And again, I think it's worth reflecting on how many of these organizations that you interact with currently and you touch and feel every day are already driven by the power of AWS. Indeed, those of you who are based in Singapore have had this directly in your hands during the last few years with the vaccine management platform scaled by IHIS that was built on AWS. And again, the power of the cloud being able to scale a vaccine management platform from 8,000 vaccinations daily to a peak of 80,000 vaccinations in the space of 4 weeks. And I think it's that democratization of access to scale that is absolutely transformative. So, I don't need to tell you that AWS is the cloud computing arm of Amazon. You heard in the keynote this morning about our global infrastructure and our ability to go global in seconds. So what I'd like to do is specifically focus on healthcare in the cloud. And I'd like to talk about why healthcare in the cloud, some global trends that we're seeing, our strategy, and some takeaway points at the end. But in fact, what I'm going to do is I'm going to give you some spoilers before we actually get to the end. I'm going to give you my takeaway points up front. And that way you can actually, when you look at the presentation, you can look at my takeaway points. So when you get to the end, you go, okay, I understand. So my takeaway points are, number one, healthcare is undergoing a massive shift to the cloud. And you'll see the reasons for that. And you'll also see that some of our industry challenges are already being met by the use of cloud. And democratization is the key. So it democratizes access not only to the data and to the analytics tools to put power in the hands of our computer scientists and our clinicians and our tech companies to build the next generation of healthcare solutions, it also democratizes access to those solutions to actually allow care providers to access care solutions at the point of need, and also allows patients to interact with their data at the point of need. And I'll be interested to know, as you listen to the presentation at the end, what questions you have that you think could be answered. So, Why healthcare in the cloud? Well, first of all, a lot of this you know from the keynote. The bedrock of what we do is security. So we know that AWS Cloud is architected to be the most flexible and secure cloud available. We have the shared responsibility model that doesn't change from when you're running on-prem workloads. It's still the responsibility for the user to make sure their data is encrypted and access is limited only to those that need it. But we bring scale. And there's a lot of concern around healthcare data saying, can we put healthcare data in the cloud? The answer is yes, you can. And we can help you architecting securely. We can do well-architected reviews. We have compliance experts that allow us to work with your regional security protocols, because not every country is the same. Security procedures differ. Compliance differs. We're able to work with customers to make sure that they are architected securely and appropriately to make sure their healthcare workloads are safe. As a clinician, I really want to know that the machines work when I turn them on. It's a very important thing. So as a radiologist, I want to make sure that I have maximum uptime. And again, AWS provides unparalleled availability and durability. And if architected correctly, I think those 5 nines of availability, which everyone always quotes, are really important. Service interruption is something that, as a clinician, I don't want to tolerate. And we see that big healthcare organisations such as New South Wales, so New South Wales Health in Australia, are migrating their entire healthcare ecosystem onto AWS. They're seeing reductions in unplanned outages of up to 70%. So it's really significant in the field for those people using it. Cost savings are often a starting point in the conversation. And we see reduction in IT costs with running hospitals. When hospitals are under intense pressure, especially during the pandemic, to make ends meet, the healthcare system has become under tremendous financial pressures. We see cost reductions in the order of 25% in terms of IT cost. But we see increased productivity as well. So it's not just reducing the cost of IT, but it's also increasing productivity. So again, New South Wales are realizing benefits of up to $25 million through cost avoidance, reduction in capital expenditure, and increased productivity. And in fact, speed to innovation is the key. So what we're seeing from our health tech customers is they're not so much focused on cost. They're focused on, can we move to develop applications faster to get them out there? And so we're seeing up to a 28% reduction in time to market for new features. That's why some of the world's largest health techs, GE Healthcare, Philips, are re-platforming their imaging applications onto AWS. And finally, elasticity, so the ability to scale up and scale down, super important when working very time-dependent workloads. Vaccine management, for instance, massive spike in requirements, the system does not go down. When we're working in India, so the Indian vaccine management platform was built on AWS. CoWIN, phenomenal program built in AWS native services by the government of India and our partners there. They have delivered over 2 billion doses of vaccine using that platform. And at the peak, they were delivering 25 million doses per day of vaccine. That is absolutely extraordinary. And they can scale up and they can scale down without the system failing. Now, democratizing access and IoT and AI, IoT and machine learning, I'll come to in a moment. But these are the core things, the core foundations, which are common to all industries, but they're super important when it comes to healthcare, in particular that availability. Now, global trends. We see numerous things that are affecting the healthcare industry. We're seeing an aging population, the need for social care, care at home, aging in place is really important. An unmet demand or lack of capacity in the care providers. We don't have enough nurses and doctors or care or staff. How do we make them more scalable? Massive volumes of data, as you well know, drive to improve efficiency, healthcare famously inefficient. And of course, there are many sophisticated security events taking place. Now, these data are before COVID. These are pre-COVID data. Following COVID, the impact on the healthcare systems, as I've said, has been profound. And the need to digitize and to innovate and to create new systems of operation to support patients has become even more pressing. So we've seen some global trends and growth drivers. So you see here is a chart. And so what we did is we looked at the health system subcategories according to the World Health Organization, and we looked at the relative market size. Who were our customers, or what were our customers looking at to invest in? And we see here the two biggest: genomics, electronic healthcare records, closely followed by imaging, telehealth, and analytics, with a long tail behind of other solution areas. So this kind of sets our weather vane of what our customers are interested in, where their focus is. So on this, and through customer conversations, we've developed a mission and a strategy. And I'd just like to go into those very briefly to tell you a bit about how we are approaching healthcare. So our mission is to enable access and delivery of person-centered healthcare, driving improved outcomes at a lower cost by accelerating the digitization and utilization of healthcare and life sciences data. And the key word here is enablement. We don't want to be an electronic healthcare record. We don't want to be an imaging system. We don't want to be an HIE, a health information exchange. But we do want to be the best cloud platform to run all of those solutions. How do we work with our customers to deliver? When I talk about our customers, I talk about national governments, state governments, hospital networks, research organizations, diagnostics, primary, secondary, ambulatory care, social care, pharmacy and dental on the provider side. On the payer side, working with the largest government payers and private payers. And then the health tech ecosystem that supports all of them. And we want to provide services that these health techs and some of our customers who are builders can leverage to build solutions faster. So our four strategic pillars are mission workloads, national strategies, innovation, education and startups, and seamless delivery of care. And I'll just touch on each of those. So for the mission workloads, as I've talked about, we see where our customers are most interested: electronic healthcare records, genomics and imaging. So let's go into the first one. So there is a massive shift to cloud in electronic medical records. Daedalus, biggest electronic healthcare record provider in Europe, is shifting some of their major electronic medical record applications. Daedalus is providing Lorenzo, which is the application used by 50 hospital trusts in the UK, all onto AWS in production. Epic Health Systems, I'm sure you know Epic. Epic, we are hosting Epic now in production in the cloud in the US. So Tufts Medicine, formerly Wellforce, now runs Epic hosted on AWS. Now previously, the cloud was used as kind of disaster recovery backup. We can do that, but we're going to run on-prem because that's safer and more secure. We're seeing, given all of those things I said earlier about availability, scalability, security, a shift. And the shift is taking place now. This is something happening in real time. Geisinger Health in the US, another major health system, is moving all in on AWS on the cloud to take advantage of all of those things I just discussed. And we're going to see this more and more as we go on. Medical imaging, likewise. I'm a radiologist. I like available and scalable radiology solutions. As I said, Philips and GE are replatforming their imaging solutions onto AWS. Visage Imaging is a cloud PACS company which has just won the contract for the whole of the University of California health systems. So the whole of the University of California is going onto the cloud PACS in production on AWS because they take advantage of the scalability and the democratization of access of that solution to all of those care providers. We're going to see this more and more. Diagnostics is going to be a major area for this, integrated diagnostics in the cloud. Genomics. Illumina is a great partner of ours. They've built their ICA platform, their connected analytics platform that runs using AWS native services. The UK Biobank, the largest biomedical repository in the world, 500,000 fully sequenced genomes and all of the clinical data, and all of the pathology data and the imaging data on AWS. They've got 40 petabytes of data. 40 petabytes. I had to try and put that as some kind into, I had to put that into context somehow. I can't even visualize what 40 petabytes looks like. So the way it was described to me was, imagine watching 4K video. You watch 4K video? No? Well, you watch 4K video? Yeah, 4K video. You have to watch 4K video every day, 24/7 for a century. And that will get you to 40 petabytes. Okay, that kind of puts it into context. That's why they're moving to the cloud, because they can't use on-premises solutions. They don't have the capacity. University of Chicago is building out a biomedical research hub and building out something called Gen 3, which is a federated data platform for genomics. Really interesting. Now, federating data sets around the world on the same standard. Now, that is interesting. And healthcare analytics and AI and ML. Moderna built their vaccine management platform, their drug development platform. Using AWS, they created their putative vaccine for COVID in 48 hours after receiving the genome. That's how long it took them to create their vaccine candidate. That's why the time to vaccine manufacture was so short. It took out months and months of computing power to develop a vaccine candidate. That's the scale that cloud can bring. So that's the democratization of access to the data and the computing power. In Brazil during the pandemic, they developed something called the RADVID-19 program. So the Hospital das Clínicas Innovation Center actually leveraged several AI tools to analyze chest CT scans. So patients that had scans of their chest are all around Brazil. A lot of the hospitals didn't have experts. They didn't have radiologists who are expert in chest reading films and said, we don't know, do they have COVID or not? So they built a national platform where any hospital in Brazil could upload their scans onto the platform 24/7, and then they would get read by 2 different AI algorithms, and then within 10 minutes, the result would be sent back to the hospital with a likelihood score of COVID. And the pictures segmented to say these are the areas of lungs that are affected. That is power put into the hands of clinicians at the point of need. It doesn't replace the radiologists, but it makes everyone smarter. Now, we introduced AWS for Health, which is a platform, you can look at it online, and it goes into these mission workloads, and it talks to our native services. So those services on AWS that you can take and build into the next generation of solutions. We've got healthcare specific services. We've got services like HealthLake, Comprehend Medical, Transcribe Medical. And we're going to be bringing out more and more healthcare specific services aimed at some of these mission workloads in the very near future, so that you can build the next generation of healthcare solution. What are you going to build that's going to answer questions? What services can you use from the AWS platform that'll increase your speed to solution to help your clinical staff go faster? So that's our number 1, mission workloads. Number 2, national strategies, which is very pertinent given your announcement yesterday of your Healthy Singapore initiative, with $1 billion being, earmarked to go into population health and wellness. That's a very good overlap with our second pillar. So our national strategies focus on 2 things: population health and health equity. So when we talk about population health, the definition was the health outcomes of a group of individuals, including the distribution of such outcomes within the group. We have our own kind of internal version of what we think population health is, and it's up on the board. I won't just read it out for you, but you can see that's our definition of population health. But what does that mean in the real world? Well, we hear from our customers what it means, that there are vast amounts of data, but not just healthcare data, other associated data, social determinants of health, housing conditions, nutritional status, need for food supplements, social welfare benefits. All of these things impact people's health. How do we reduce costs in health systems? By knowing the totality of the health system spend. How do we address some of these disparities? So there are some primary pathways for population health. We've got to have data. We've got to be able to enrich that data so we can understand it better, make it interoperable. We've got to have an understanding of some quality metrics around it. We've got to have a value estimation. So we've got to have some cost and outcomes analysis. And we've got to engage individual citizens. Now, to put that into practical terms, what does that mean exactly? I'll give you converging examples. So Genomics England has a multimodal data set. It has a bit like UK Biobank. It has genomics, imaging, pathology, clinical histories that traditionally are all siloed. Genomics England wanted to build a platform that separates the applications layer from the data layer. So it doesn't matter what you use to collect the data, which interface, which electronic medical record, which PACS provider. They wanted to make sure the data was kept separate, and so they could curate it and make it interoperable and then put machine learning layers over the top of it to gather greater insights, not just about clinical data, but also about the associated healthcare data. And as we talk to more customers, especially at national level, those social determinants come into play. How can we collect and integrate vast quantities of patient or citizen-related data? GovChat is very interesting because that's at the other end of the spectrum. This is about interaction with the individual. So GovChat is the biggest, or it is the de facto government citizen interaction tool in South Africa. So GovChat was created by a brilliant entrepreneur called Eldred Jordan. He created the platform during the pandemic because the government couldn't give social welfare payments to its citizens. You'd have to queue up in a queue normally for 2 days, fill in forms before you got access to your welfare. GovChat was built to provide electronic access in a seamless way remotely. Since then, it's been built out to be a government engagement platform. So now every citizen in South Africa can access the platform. It has over 9 million active users, but also they've built in connection to 60,000 government entities or government locations. So not only do citizens get access to their own data and they get access to their own payment systems, they can feed back to the government about what they think are the government services. So if you go to a healthcare clinic, it'll be on the app. You can actually feed back about your experience. So the government have got bi-directional information exchange. Now put these two things together. You've got big data on one side, integrated with machine learning on top, and then you've got an application that allows you to interface with the government. You end up with something a bit like Metro Plus Health. So during the pandemic, Metro Plus Health is an insurer in New York. They insure 500,000 people, and they've got rich data about the insured population. Healthcare, social determinants of health, mental health, need for supplements, children, everything else. They built a platform, an AI platform, with Bain Consulting and AIR NYC. And that platform looked at the data and it extracted meaningful insights to understand risks that citizens may be facing. So it wasn't just, oh, you've got diabetes, you may be at a higher risk of COVID. It's, you need supplemental payments. Can you access them? Here is a way of accessing them. You might be running out of medication because you can't leave your house. Here is a link to an e-pharmacy. We are going to actually provide you proactively with a pharmacy supply chain which will actually provide you with things that you might need. So there was a chatbot, an interactive chatbot that reached out to individuals at risk and provided them with services proactively. Now, if you imagine that done in an era only 5 years ago, that would require thousands of person hours on the telephone calling people, looking through notes, saying, "Are you at risk? Can we help you?" This makes it scalable and automated, and that outreach is personalized. Fascinating. Now, I don't know if you were there at the talk just before lunch. Really, really great talk by the professor in the National University Health System. And they have created a brilliant application called One NUHS, which does a bit like the GovChat app. It does that patient engagement interaction chatbot. There's a brilliant piece they've done on top, which is sentiment analysis. Amazing. The chatbot responds to how you feel and tailors the response to either a neutral response or a positive response based on the sentiment of the person that's actually engaging with a natural language assessment. Amazing. They're building Champ, the Champ interaction tool, which is essentially like the one, the previous example in New York, where with proactive outreach at citizen engagement across the entire population they cover. That will be a fascinating rollout in Singapore when that happens. Health equity is the second piece of that. So population health is on one side, health equity, because once you understand the data, you can see the disparity. So we were very privileged to launch last year the Health Equity Initiative. $40 million over 3 years to support initiatives that address inequity of access to healthcare, social determinants of health, and data collection to show health equity. And we've just opened another branch, which is about diagnostics, access to diagnostics, and inequity of access. At the moment, we've dispersed, after 1 year, $14 million to 90 projects. It's open to any of those customer groups I said, national government, state government, research organizations, individuals, startups, health techs. If you've got a project that you think addresses something around health equity, please come and talk to us. Be fascinated to learn more. Hyrax Bioscience is a genomic processing organization that runs out of South Africa. They've been supported by us. During COVID, they're now scaling up on other transmissible diseases. That's our second pillar. Third pillar, innovation, education, and startups. It's kind of a non-technical piece, actually. So we work with a lot of universities. We've got UCL, Centre for Digital Innovation. We've opened up the Cloud Innovation Centre in Singapore, as you know. We have a Cloud Innovation Centre in UC Davis in California focused on health equity, in fact. I'll just pull out a vignette from the University of British Columbia. They did a project called Serratus, and they looked at the whole global viral genome. There's actually a repository where every virus gets genomically sequenced and put into a bucket. No one looks at the sequence, it just gets sequenced and put into a bucket. They ran a project to look at that whole viral genome. And they found, with their analysis of the whole thing, 132,000 new viruses, of which 9 were new strains of coronavirus previously not even found. And they estimated that it would take them 2,000 years of computing time and hundreds of thousands of dollars to do that research. And they did it in 11 days. And it cost them $24,000. Again, democratization of access to data and computing power makes that scale amazing. Also with innovation is the innovation methodology, and I think that's what makes us really different. When we have healthcare conversations with our customers, they want to learn about how AWS innovates. How do you keep a big organization continually innovating? And we have very transparent methodology for that, working backwards, PRFAQs. We can teach you if you would like to know how we do it. And that is often a component of conversations that we have. Startups, we run healthcare startup accelerators. After innovation, there are spin-outs. So we launched a healthcare accelerator last year in the US, this year in the UK. We launched a healthcare accelerator for health equity very recently. And training and upskilling, massively important. 3 blockers for healthcare in the cloud across Asia Pacific in a survey done by Access Health very recently. Policy, so making sure that we've got the right policies in place to use healthcare in the cloud. Procurement, making sure organizations can actually know how to buy cloud. And then professionals. Absence of the professional groups who can leverage cloud at all levels. So understanding healthcare, what healthcare can do at a CEO level, a clinical level, training the doctors what healthcare can do, the power of the cloud. But then this large group of healthcare IT workforce that need to be upskilled. And we are investing in them. We're investing going to train 29 million people by 2025. And we have a head of global healthcare workforce education. So again, if that's something that you are suffering from, we're very happy to lean in and support you. So finally, seamless care delivery. And this is kind of the future-looking piece. This is how a patient's going to be managed in the future. And I would argue that healthcare in the future is not going to be only hospital and clinic-based. It's going to be ambulatory. There's going to be a whole group of things that hospital at home, Internet of Medical Things, going to be a next generation of computer-aided surgery. Again, I'm an interventional radiologist. I like that computer vision and machine learning and robotics coming into play. That seamless care delivery for the individual. And part of that is also telemedicine and telehealth. And of course, there's been a massive explosion of telemedicine and telehealth during the pandemic. And we've got 3 great examples in this region of telemedicine that's been spun up. It's got the Chinese General Hospital and Medical Center of the Philippines. They've managed to, really digitize, fast. They've managed to get their patient discharge down from 5 to 10 hours to 10 minutes. They launched a telemedicine consultation service really responsively when COVID spun up. Doctor Anywhere, again, great success story for Southeast Asia, as is HaloDoc. And all these examples that you may well have interacted with yourselves, and you see the benefit of being able to access healthcare at the right time, at the right place. This is the democratization of access to solutions by you, by the consumer, by the patient. And when it comes to real-time monitoring and medical IoT, we've got a whole bunch of really interesting services that are available on our platform. IoT Core, IoT Greengrass, IoT TwinMaker. All of these services that can be built into the next generation of patient-centered IoT solutions. So again, we've got health techs that are building, using these kind of services to create Propeller. So Propeller is a small widget that you put onto your inhaler, and it responds to your application, and it also can respond to your care provider to say whether you're using your inhaler, how much inhaler you're using. It can also link to the weather conditions to say, the pollen count is high, maybe you should be taking more inhaler. It can show compliance to medication. Humor is very interesting. Humor really demonstrated the value of remote monitoring during the pandemic by allowing patients who had symptoms of COVID and went to hospital and were on the borderline. Maybe they could be admitted, maybe not. Normally you just admit them. But with remote monitoring and nursing supervision, maybe they can be managed at home. So they had a cohort of 1,700 patients that were suitable for home monitoring. They were sent home with home monitoring. 94% were able to be managed at home with no adverse reactions. They were managed at home and they got well. 6% required escalation and returned to hospital. And of those 6%, there were no worse outcomes than all of the group that had been admitted. So there's no increased morbidity or mortality or worse outcomes. So 94% of that group didn't need to have a hospital bed. Can you imagine the cost savings of this kind of technology if it's rolled out at scale? So, I'll return to my key points. I hope you've seen healthcare is undergoing a massive shift to the cloud, but it's now. It's not tomorrow and it's not yesterday. It's of the moment. And the key attributes that make the cloud good for all the other industries make it good for healthcare. Security, number one. Availability. Industry challenges are already being met by this technology. And I'll say again, democratization of access to data and tools to create solutions, and then democratization of those solutions to you and to me. So, that said, what do you see? What questions have you got that you can answer using some of these tools? If you do have questions, we have a fantastic healthcare team. Some of them are at the front, and they'll be available for a chat afterwards. I'm sure they'll be delighted to answer any questions you've got. They're super knowledgeable, and we've been investing in healthcare over the last 3 years. We don't want AWS just to be the best cloud platform available to our customers. We want it to be the best cloud platform for healthcare. For you, builders, to build the next generation of solutions to support our patients. Thank you very much for your attention. Now, I don't know if we've got time for any questions or not. No? Have I spoken for too long? I'll be available afterwards for any questions you might have. Thank you very much.
Thank you.